Welcome to I Wish You Could Hear This, where we explore great stories and simple proven steps to help you thrive in life, faith, and relationships.
In our research, we've heard hundreds of hope-filled strategies for marriage, parenting, leadership, and life that are grounded in science and consistent with biblical truth. And now you can hear them too.
I'm Shaunti Feldhahn.
And I'm Jeff Feldhahn.
Today, we have record levels of anxiety, depression, and other mental health needs. Many of us have loved ones who've been impacted by the mental health crisis or impacted ourselves, and it is easy to feel helpless. We feel like the only thing that many of us can do is try to find a good licensed counselor. But so many counselors are full and waiting lists are long. But what if the local counseling clinic wasn't the only answer? What if the local church was able to step into that space, at least for basic needs? Today, as we drop this podcast episode, we are also launching a book that I've co-authored with renowned clinical psychologist Dr. James Sells of Regent University, called When Hurting People Come to Church, How People of Faith Can Help Solve the Mental Health Crisis. So, if you care about mental health, if you care about the church being a light in this culture, if you want to know how you can help, that is what we are covering today on this episode of I Wish You Could Hear This.
Let's introduce Jim Sells to our listeners. Dr. James Sells is a longtime clinical psychologist and professor in the School of Psychology and Counseling at Regent University, and is the Hughes Endowed Chair of Mental Health and Christian Thought. He's also a director of the Church Cares Initiative, which we'll be talking about today as well. And he's a friend of Shaunti's and mine. So, Jim, welcome to the podcast. We've had you on before, and I'm excited to talk about this today. It's the culmination of several years of work that you and Shaunti and many others have been doing.
Yeah.
So, welcome.
It really is. Yeah, thanks so much. It really is a delight even to think back of that first phone call. I was in my car in the parking lot of a hospital while Heather was getting some imaging done, and Shaunti, you and I are being introduced by a common friend, and
who we have also had on this podcast, Jonathan Hoover.
So, and then from that conversation comes a book, and so it just
and a national initiative.
So
it's a delight to finally be at the point where we can actually start launching what we've been working on for the last 2 years.
For the average person to hear some of the things that you guys have been working toward and uncovering, it's a gift. And as we go through today, I mean, I'm going to play the role of the average person and let the two kind of experts on this topic talk away. So this is going to be great.
Yeah. So Jim, get us started. So give our listeners an overview of our new book and why we wrote it.
Everyone is familiar with the phrase mental health crisis. The crisis exists because the experience of emotional need can no longer be addressed by the professional clinician.
Mm-hmm.
Only addressed by the professional clinician. So we have a clog. We have a freeway backup. We have too many people, too many cars on the road, and not enough lanes for them to get through the given intersection that we're trying to pass through. So therefore, we have to create another system of care to attend to relieve the frequency of need that exists.
Mm. The analogy that you use that I love that you put into the book is that you grew up in Southern California.
Yes.
And I can picture this. Anyone who's ever been to Los Angeles, it's like, how big is the biggest, many lanes?
The widest point of the 405 freeway where it meets the 5 in Irvine, Laguna Niguel, so South Orange County, is 26 lanes wide.
26 lanes wide?
26 lanes, and
yes,
it's still
13.
complete gridlock.
Yes. Yeah, if you're getting there at 6 o'clock in the morning, you're likely going to be backed up.
And so
And we
the
can't build any more
analogy,
lanes.
Right.
Yeah, go
yes,
ahead.
right. There's just no more room. And so the analogy is it's just too much demand, not enough supply. And in the mental health world, just the same thing, like too much need and not enough pastors and clinicians.
Yes. So rather than think, okay, we can't build any more lanes, so we have to create a different way of transporting people. We can't create another 100,000 therapists in a given state, a given community. So, okay, we have to create another way of doing our emotional mental health care in conjunction with the clinicians. It's not like let's throw the freeways out. No, let's find other ways to get from point A to point B. Enter the church. There are 8 churches in every zip code, 8 communities that already exist where you have broken people who have identified some level of healing. We have 8 places where there's been a family with a suicide of an adolescent or a parent. People have been wounded there, and over time there's been a level of healing. We have 8 communities in which there's been addictions to which families have been able to find some level of restoration. We have 8 communities, 8 buildings in every zip code that have already addressed every emotional mental health need that exists. And there are people there that are saying, I know something about that. I've been broken, and I know healing. I know the restoration of the power of the gospel in our lives as a couple, as a family, or as an individual. I would like to help somebody. But we don't have those people who say, I would like to help someone, also trained in being the helper role or organized in any way to help the helper and the helpee get connected.
And here is what is so important about this. And I know that there's people listening to this that are scratching their heads. There's some people who are a little alarmed, like, what are you saying? Are we getting rid of the clinician? No, okay. But here is sort of the bigger picture that we all have to grapple with. And by the way, if you are somebody who you have no like psychology background at all, and you're like, why are we talking about mental health? Maybe I'll turn off the podcast. Please don't, because if you care about the church being the church, you could be the person to bring this concept to your pastor, to the care pastor, to somebody in the church, and just say, what about a new paradigm? Hey, go listen to this podcast. Hey, look at this book. Hey, look at this initiative. Is this something that our church might want to plug into? And so that's my encouragement for everybody right up front, is that this is a new paradigm. And I hope everybody will listen to this just so that they can be one of the champions to help people see that there is another way.
Very good. Yeah, I like it. I love how you're saying, and we wrote in the book of my grandmother who had an 8th grade education and a Bible and a kitchen table and a coffee pot. And that's all she needed to make a difference in her community. She could connect with the German enclave on the south side of Chicago. And that was her mission field to those mothers, wives, and their children. That's what she did. And here I'm a psychologist. I got my education from attending to my grandmother and how she cares for people, and then I got a degree on top of that. But the core, like how you care for people, you don't teach that. People already have that. They have compassion, and they can learn some basic skills to attend not to psychopathology, not to mental illness. I'll do that as a licensed psychologist, but people who carry worry, people who carry stress. You don't need a license to be able to sit with someone who's discouraged. Now, maybe you need a license to sit with someone who has anorexia nervosa or bulimia or some very severe bipolar disease. But there's a lot of people who just are sad and carry a a prevalence of in their stomach for days and days and
Yes.
days, and it never goes away. And they never talk about it with anyone, and they never unburden that that is just felt gut level every day they go to work. Like, that's what this is for.
That's fantastic, Jim. And even, as you were talking about the person perhaps with the specialized care need, the anorexic or the bulimic person, even that person, while they absolutely do need the professional care, they also still need a friend, someone that can listen to them and walk alongside them, not just in that 55-minute session, once or twice a week or once every 2 weeks, but they need that friend that can walk alongside them today and tomorrow and perhaps the next day.
Okay, Jim told me something for him as a clinician that was like blew my mind very early on in this process. And he said, and Jim, tell me if I've got this right. You basically said, look, if I am doing my job as a clinician, if the person that someone, like, let's just say Jane has been referred to a clinician for bipolar or significant depression or whatever, okay? And if that clinician is doing their job, one of the things they are probably going to say pretty early on in the process of caring for that individual is, you need to get into a community of people who support you. And so it's like they're just going to send you straight back. If they're doing their job, they're going to send you straight back to your most supportive community, which hopefully for many people listening to this is the church. And the problem is the church is in this feedback loop of, no, we have to refer people out. Like, that's what we've kind of gotten used to over the last 30 or 40 years, because we think, I'm not a specialist. Right? I don't know, so I have to refer people out. But if the counselor is doing their job, they're going to refer them back in. We've got to build the capacity.
Right. Yeah. And I have even caused great offense amongst my colleagues in the clinical world by saying, if I have my choice of anybody having a really, really good friend or a really, really good therapist, take the friend. Because that friend is there from beginning to end. Those community of friends will walk with you for your life. I'm there for 10 weeks, and we'll create an intervention of empirically validated treatments, and like bang, we'll reduce your symptoms, but you still need the oxygen that comes from friends. So,
and the church has to build that, which is why we wrote this book, and which is why Jim is leading this initiative called The Church Cares, to try to help churches for us to grasp this new paradigm, and then also to have a little bit of hand-holding, like what might that look like? And this has been, I will tell the listeners of our podcast, this has been one of the most fascinating projects that Jeff and I have done in the last 22 years of doing these research studies, where in this one, I think, gosh, Jim, what did it end up being? It ended up being more than 2,000. We interviewed and surveyed more than 2,000 pastors and church leaders. And we just did so many interviews to say, hey, to the churches that are already doing this kind of thing, what are you doing? Let us learn from you. And if you're not, why not? And seeing what are the perceptions around this, and then doing a big national survey of all the streams of the church in order to figure out, like, how does the church view this? And one of the things that we found is that churches, this is going to be horrible, okay? But pastors, by the way, if you're listening to this is not pejorative. I'm just telling you, this is what we saw in the data, is that churches are a bit bipolar, because churches and pastors both think, 88% of pastors said, well, the primary role of the church, if it's a mental health issue, as opposed to a spiritual issue, which is, by the way, sort of a false dichotomy. But if it's a mental health issue, if it's a psychological issue, my main role is to refer out to a good clinician. But at the same time, 96% of those same pastors said people walking alongside one another and caring for one another is one of the best ways to build good mental health in the church.
We all, I'll take another analogy. Every church knows that if you have a really successful, a really powerful draw for adolescents would be if you have a basketball program. Every church knows that, but very few churches build a gym. And what we're trying to say is, hey, here's how you build a gym. And
Great
you
example.
know that there is a tremendous response to the ability for young men to recreate around the game of basketball. Good. And this is a gym. This is a project that doesn't cost you, $1 million to build a gym. It's free. We can provide you the resources to prepare your church to be able to do this, to create the gym where this activity that will have high impact on your community and bring people into the church to hear the gospel. Yep, that's how you can make it happen.
And the pastors may think, oh my gosh, I don't have the resources or the time to build a gym. Okay, so build a basketball court in the backyard with 2 hoops.
Yep.
And like a basketball and a place that you can
Yes.
play pickup ball. You don't need the gym. You don't need the air conditioning. You can just
start
get
it.
started.
Yes. Yeah. You don't have to have a staff. You have to have people who have compassion for other people. And every pastor can identify a lot of folks in their pews that are quite capable of being present in the emotional pain of another. They've been there.
So, can I ask a question here? And it's the so why, if there's this need out there, we recognize it. Why haven't we been doing this? And I'm going to point the finger, just to surmise that folks like me might be some of the problem.
Since you're an attorney?
Since I'm an attorney. And, I think Shakespeare said it, that the first thing we should do is kill all the lawyers. And I recognize that there is probably a significant amount of fear and perhaps misinformation that pastors face and feel about this particular serving in this way. So how do we disabuse them of that fear?
We had an attorney, a colleague of ours at Regent, a professor in the law school, serve as our legal consultant and help draft the principles necessary for every church to be aware of. One of the things that he found and he wrote about was do what you're called to do. Churches are called to preach. Churches are called to share the gospel. Churches are called to administer to the sick. Churches are called to minister to the homeless and to the those who need food and shelter and clothing. So if you if the church is attending to their mission and are careful not to attend to not to stretch their mission beyond their scope. For example, it's one thing for me to have a distribution center of food and clothing in my church. It's another thing if I said, come to my church because I'm a restaurant, but I don't have to be licensed as a restaurant, and my specialty will be Japanese sushi. No, that's not what I do. But I can distribute beans and rice and I can distribute food that has been donated to me, and I'm not a restaurant, and I don't have to worry about uh, having people die as a result of my incompetence as a non-sushi chef. So
So
counseling is the same way. Go ahead, Shanti, take it
I
the rest of the way.
love that example, Jim, because here one of the things that I just want to say this. I do not want to make this a commercial for the book, but I am. So one of the things that we did in the book is we put an appendix with some of these legal principles and some of these points so that a church can literally just go boom, 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 boom. Like, for example, one of the pieces of the puzzle that helps protect any church is to literally just change your bylaws, change your documents to say we view care as a religious exercise. This is discipleship. This is evangelism. This is not therapy. This is coming alongside those in need,
Fulfilling the
and
Great
fulfilling
Commission.
the Great Commission. And suddenly, if you do that, you have officially said this is a religious exercise. The courts aren't able to say, well, you can't do it that way, because that is part of a faith statement. Now, if you are suddenly going to be doing like actual clinician stuff and you have licensed clinicians on staff, then yes, of course, you have to abide by the licensure of the state. But what we're talking about is a different level. We're talking about, okay, you've got high up, specialty, like think of a pyramid. And Jim created this great pyramid graphic. Think of a pyramid that as you go up in the pyramid, you get more authority and you get more specialization. And think of like the pastors and the clinicians, the mental health professionals, the psychiatrists, the people that get referred to as being at the top of the pyramid. They're the ones when you have a really, specialized need, like the person who has anorexia, okay, they need that specialized care. But as you go down in the pyramid, it's like, okay, we're not necessarily quite that high up. Maybe the middle, we call them trained helpers. Maybe that's the person who runs the Celebrate Recovery Ministry, or maybe that's a group like Stephen Ministry where they have 50 hours of training in caring for others, or a lay counselor. They're not a licensed person, but they've got a little more training. But think as you go all the way down, you're just talking about lay listeners, friends, people who come alongside who can truly care about the basic needs. And you may say, okay, you've got a really significant marriage issue. Okay, maybe you really do need a counselor. But you know what? Maybe you also need a friend to have dinner with on Thursday nights with another couple that has a good marriage. That's that lay listener level we're talking about.
And what's coming to mind, and I'm not looking it up, but I think it's Galatians 6:2,
Okay.
which says, "Bear ye one another's burdens, and thereby fulfill the law of Christ," or the gospel.
Yeah.
And that's what we're asked to do. It's what we're commanded. It's not when you're feeling like it, bear one another's burdens. We're called to do that for one another. And that sounds like that bottom level group as well as all the way up to the top. But I like that a lot, that framework.
Yeah. And to my colleagues as clinicians, as counselors and psychologists, I am not trying to put you out of work.
Little chance of that.
Little chance. So we are not seeking to undermine the mental health profession and denigrate it as, oh, they can't do it. We should do it better over here in the church. No, we can't do as a church. We can't do what clinicians do.
Yeah.
And clinicians cannot do what the church can do. And I cannot as a licensed psychologist have the kind of friend-to-friend relationship that would say, well, you need a place to stay? I can help you get that. We have the "What About Bob" movie that is clearly the humorous joke about what happens when there is no boundary between clinician
Right.
and client. No, we keep it. But to go to a different movie, we have Les Miserables that the pastor connected, the Monsignor connected with
Jean Valjean.
Jean Paul, and like changed his life. That's what the church
Yes.
can do. So like, no, I know what my job is as a clinician, and then as a Christian, it's a different job, and we can train people to do both of those things, to care for people as part of a community, and to provide an extensive professional level of care. And I would encourage the clinicians to think differently about their job. As a psychologist, full-time psychologist sees about 200 different people a year. We have a line out the clinician's door of 18 million people who are in need of therapy. And we're taking care of them at 200 per clinician per year. We're never going to get to the end. So rather than think of your job as having 200 clients, what would your job look like if you had 10,000 clients? You have to think of doing it a different way. So now you're going to be working with the most severe of those 10,000, and you're going to create a triage system in which you oversee maybe dozens of people who can work as a lay counselor, as a volunteer, just to attend to the relationship needs of the vast number of people that would otherwise come to see you. So building a different way of thinking about the mental health profession and inviting the church to participate as a partner in it.
And this is your other book, Jim. Tell them about your
Yeah.
other book for
Yeah.
if for those who are
the
in
year-
the clinical
the-
space.
Yeah, that's right. I didn't even think about it. I was just pitching the other book. Thank you, Shaunti. Like the, a couple of years ago, I published a book with Amy Trout and my wife Heather Sells, a book by InterVarsity Press called Beyond the Clinical Hour, and that's an academic book. It's written to clinicians. It's the same model, but from the other side of the equation. So they have to be thinking about looking at a different world, and the church has to be thinking about involving itself in a different world, rather than the world of everything gets referred to the clinician. We have to train people to be different in the way they do therapy. If we do have a triage system of volunteers and multiple tiered levels of care.
If I can put on keep on my hat of the average churchgoer here in this conversation, if we're doing this well, it would seem like this is not only appealing to serving the people within the church body, the local church body, but in the greater community, people who, have no relationship with Christ, but have a need. And I'm thinking how I used to feel when I was 18, 19 years old and a new believer, and I thought one of the things that I dreaded was the idea of, as part of my Christian faith, handing out tracts on the beach during spring break. And it felt artificial, not me, frightening, terrifying. And now here, what it sounds like I'm hearing, if I could sign up for one of these roles, say a lay listener, people would come to me who may not have any faith experience, and I can serve them. And who knows where in that serving it goes, but it hopefully can lead to them entering into a relationship with Christ. I mean, that sounds like a good deal for me, and it's just my time.
Jim, tell them the story that you started Beyond the Clinical Hour, the book for counselors, about driving through South Carolina.
Yeah. Some things, little experiences happen that stir you. And this was not unique to me. I think just about everybody has those experiences in their life where you drive by a house and you say, I love that house. and 20 years later, with your family, you find yourself buying that house that you loved for your life. And so I was driving through South Carolina, Anderson County, past a church, Baptist church, looked like every other Baptist church that you would see in rural America, bricks, white steeple, and a sign. And the sign said, Family Council available. And every other church that I've ever driven by has worship services at 9:30, or sorry, Sunday school at 9:30, worship service at 11, prayer meeting Wednesday at 7 o'clock. The times in which we're open for business. Come here to this time. This church had the insight to say, you know what, people who are driving by here, they see the sign for our church services and they don't show up for that. They're not driving by looking for a place to go on Sunday. They're driving by worried about their kid who has the evidence of an opioid addiction, or they're worried about the possibility of their marriage dissolving, or their child who's so far behind in school that maybe we have to hold him back or hold her back rather than enter middle school, or we have a declining parent who lives in the apartment behind our house, and they have early onset Alzheimer's, and we can't afford the kind of treatment necessary for their safety and protection. What do I do? So this church figured out the best thing we can do on this country road in this rural community was just put up a sign and have somebody in there who can say, bring your problem here, let's talk it through. I don't know what kind of services they had. They were not, I doubt they had professional clinicians, but they might certainly have one or two. It's a small rural community, but they probably had people who were just saying, we'll talk, we'll listen, we'll help, bring it here. This is where we'll start. And that, I stopped and looked at that sign and thought, there is something here. And from that was the impetus for the first book, and then the conversation about the second book with Shaunti, and that has brought us to the Church Care launch. That is not just a book, it's also a website of resources so that any church in any denomination, and in Spanish or in English, can start a system of organized care training to prepare people in your church to sit with other people in pain. So what I miss, Shaunti, because you're the co-author of the whole thing. So
no, that was a great way of explaining it. The vision that I want to leave everybody with, we're going to give some practical thoughts here in just a second, but the big picture vision that I want to share is something that happened in a conversation just a few weeks ago. So Jeff and I are going to be doing a marriage event at a large church in the Midwest. And so I was on a Zoom call with the pastor and talking about, all these different things. And the subject of this new initiative came up, and this book and the research with the pastors. And I was asking him a couple of questions and explaining the concept of lay care and building up this layer of lay care, kind of a parallel system of care in the church, and really, truly, the church being the church and not being afraid of it. This is what we've been doing for 2,000 years. It's only in the last few decades that we've kind of gotten to this idea of everything has to go to the clinician. And so we started talking about that, and he said, oh my gosh, I know. He's like, because we don't know. We're, pastors, we're not specialists. He said, for example, yesterday, so this was a Monday, we were having this conversation, and yesterday, had been Sunday. He said, after I preached and, the service was over, I was standing in the lobby, and he said, this happens every week. And he said, for example, this one, young woman came up to me and she was crying. She was in tears. And she said, Pastor, I have to speak with you. She's like, I don't know what to do. I was sexually abused as a child. It's impacted everything in my life. I don't know how to handle it. It's impacting this and that and the other thing. I need to come talk to you. And he said, of course, I'm like, here's my assistant's number. And he said, but to me, the next day, he said, I feel so helpless because I know what's going to happen. I'm going to see her and I don't know what to tell her. And so I'm not a specialist. So I'm going to refer her out to at the counseling clinic that's down the road, and they have a really long waiting list, like most counseling clinics today. And it might be 5 or 6 weeks before she gets in. And he said, I just feel so helpless, because that's all I can do. And I said, I totally get that. Let me give you a slightly different vision that's slightly different and yet very different. Imagine when she came up to you, if you were able to say this instead, and you were able to say, I am so sorry that this has been part of your experience. I'm so sorry to hear that. And of course, if you need to come speak with me, we will work you in. Just so you know, I'm working a few weeks out and I don't want you to have to wait that long. So I'm going to get your name. I'm going to get your phone number, and I'm going to have Bonnie call you. Bonnie is a retired nurse in our congregation who serves as our care coordinator. And she's going to listen to you and hear your story. And if you need to be referred to a clinician, we'll do that. But you know what? We have a team of people in our church who are just trained to come alongside and listen and be present. And I happen to know that at least one of the women on the team that Bonnie leads has that same story. She has that background of sexual abuse, and she loves being able to walk alongside other women and care for people because she gets it intimately. And so we will, no matter what, we will care for you. But it may look like these different levels. And I said, imagine that you could have said that to her, Pastor, and you could tell it's just such a small switch that, okay, when the call comes in to the receptionist, when the call comes into the pastor's assistant, when the small group leader sees that somebody is in trouble, instead of calling the pastor first, everybody in the church knows to get into the care coordinator who does the triage and is able to refer to whichever level needs it the most. And just building up that capacity, that simple capacity, really is kind of like just building a basketball pad in the backyard of the church.
Yeah.
It's just a starting point.
Yeah, that's a wonderful parallel story to what we're trying to do, and it's within reach that every person can have a relationship with Jesus, enhanced, supported by someone who knows your story, someone who can attend to the details of your story, and make guiding recommendations even to clinicians who might be prescribing medication or other treatment protocols, but at the very least, you got to have a friend. And I love here's what we do in a nutshell. We are a church example of the TV sitcom Cheers.
That's great.
I love that.
Yes.
The theme song.
And
there you go.
Yeah, everybody wants to go where someone knows your name.
Right.
And that there's also, how about this one? Sitting on the corner of the bar is the Kelsey Grammer character, a psychiatrist. Where does he go? He hangs out at a bar with other people who know his name.
Yep.
And everybody wishes they could have the relationship with a community of people that when you walk in the door, people say, "Hi, Norm."
Yep.
Norm.
And that's
Everybody wants that.
Yeah. So now it's done in a fantasy level at a bar because that's not ever where it's going to happen. But the church is the healthy environment where actual friendship can take place, and support around our daily struggles, and Cliff's frustration with the U.S. mail, and like every other human foible and inadequacy that is brought to light in those characters. where it can be there can be a human connection around where it can be supported, encouraged, and loved.
So, building on all of that, average listener here, what can they do with this information
Yeah.
and how can they participate?
Yeah. Um, it's really easy on ramp. One practical level is just go onto our website, thechurchcares.com, all one word, the church cares. And don't forget the because you go to a different place if you just put church cares. So the church cares, and just start tooling through it. And it's possible for you to take training within your church if your church has a critical mass of people who want to do it, or to get training outside the church, outside yours own, but participate with other believers who are not affiliated with the church that just want to learn how to do it, just want to learn how to listen to others. You respond to the invitation to get your email, and our team will start communicating with you around what you need and where you can go. And then you can possibly take this to your pastor, take this to your care minister team, take this to the next level up in your church that can facilitate its implementation. It's not hard. That's the beauty of it. It's we're not having to build a jet engine. We're having to ride a bicycle. And you have 1,000 bicycle riders, and you have just a wonderful experience together. This is not complicated. It's a real basic transportation.
Well, and let me just also add in here before we close, one of the things that people tend to expect, oh, let me take this to the pastor so the pastor can do it.
Yeah. Oh,
No.
yeah. No.
What we
No.
need is people who have a passion for the church being the church to take this to the church, to go to the pastor and say, I think this is important and I'm going to help put
Right.
this together.
Yeah. Yeah. And that pastor might be able to say, you can ask, who else do you know that has the same passion?
Yep.
Then let us build it out, and we have a proposal coming to you in 2 months.
Yes.
And we'll go through the training. We'll create the vision, and we'll partner with other churches that are doing this and see if we can put this together. And you just have to give us the green light. You don't have to administer it. You don't have to put another budget line in the church budget for next year. This can happen. It's not that hard.
And I want to say one of the things that Jim and his co-director Jen Ripley and several of the people on our team have been spending a lot of the last 6 months creating a kit that any church can get, download, look at all the different pieces, figure out what makes sense for you. Every church has a different DNA. There's no one right way of putting this program together. We just give you all the pieces. And so you can, and this is all free because a major donor stepped forward and said, we want the church
Right.
to be able to step into this space.
And you mentioned Jen. Now, Jen, like your other colleagues that help put all of this together, Jim, are PhD psychologists, correct? I mean, there was a lot of experience and skill brought to bear on developing
at
this.
the same time, there was a lot of experience and skill brought together and a lot of attention to let's put the cookies on the lowest shelf.
Yeah.
Let's make sure that it is clinically excellent, but also let's
Accessible.
make sure that it is accessible for the average person who just cares for others.
That's fantastic. Now, gosh, I wish we could go on forever, but Jim, we always try to end our podcasts with kind of asking our guest, and you being the guest, what would you, if you could leave one kind of big takeaway for our listeners, hate to put you on the spot, but what would that be?
Yeah. Everybody hurts. Let's just start there. So you are not attending to those few people whose lives are a wreck. Everybody hurts. And the helpers are the helpees. And so we're not looking for the special few people that whose lives are together. I've never met that person because everybody hurts, everybody suffers, everybody has wound. You don't go through life unscathed, and everybody has the capacity to render care in unique ways based on their personality and then based on some basic training. Like, this is not hard, even if you choose never to be a quote caregiver listener. I want this in my church for the person that works in the nursery department on Sunday morning,
Yeah.
because they're going to hand a kid off to a mom, and the as you hand the child off, this 1.5-year-old, you're going to say, she had a blowout in her diaper and we didn't have one in your diaper bag, and the mom is going to start crying because a wave of maternal incompetence is going to just kind of sweep over her. It could be a dad too. He might cry too, because it's like, we are so exhausted. Now that nursery worker, skilled with some basic listening, helping competencies, is able to just say, "Oh, I'm sorry, but rather, can we just talk for a while? Let's pray. Let's hear your story, and let me engage with you about where you might want to go if you're overwhelmed here." And that's what we're here for. We're not just here to watch your kid while you go to church. We are here to see to it that every aspect of your life is blessed. So this is not for just the counselor types. This is for everybody that shake hands with another person in a church community that says, I wish to be involved in your life.
That's the goal of all of this. And this is, honestly, this is, when you look at what Jesus said, that, we're supposed to be a city on a hill, and that implies, the giving light to those in the valley, right? In the hard moments. And that by this, all men will know that you're my disciples, that you love one another. This is a practical way to do that. So we hope everybody can capture this vision. And I just want to thank Jim Sells for coming on the podcast today. If you're listening to this, if you're not a subscriber to our podcast, please do subscribe. Please pass this along, this particular episode, to the clinicians the pastors the folks who have a passion for mental health, for the church being the church. Pass this along. Share this episode. And we would also ask, tag us on all your social media channels to help us get this word out. Thanks, Jim, for being with us
So
today.
good to be with you, Shaunti, and you, Jeff. Delighted to spend an hour with you around things that we love. Look forward to seeing you face to face at the next incursion. In a month, I think we're going to be together.
Absolutely.
Always glad to be part of your ministry here. Well done.
Thanks,
Us too.
Jim.
Thank you, Jim.
Thanks for listening to I Wish You Could Hear This. Remember to subscribe to our podcast. And as always, forward today's audio or video link to a friend, counselor, or pastor who would be encouraged.